Okay, it's just after 7 o'clock, so I guess we will begin for tonight. Good evening, everyone. My name is Rob Hatton. I'm the communications manager with Grey County. And joining me on the call this evening is Jennifer Cornell, our Director of Long-Term Care, and Denna Leach, our clinical specialist for Grey County Long-Term Care. Our format for the call tonight is going to be similar to what we've done in the past. So we are going to hear an update from Jennifer, and then following that update, we will open it up to a Q&A. So I would ask that you do use the Q&A feature in Zoom to enter your questions, just to make sure that we don't lose track of anything as we go along. I will try to monitor the chat as well if I see anything in there, but the Q&A is the best place to put something just in case, so we don't miss it. Now, just before we do jump in, I just want to clarify that our call tonight is focusing on the 3 homes that are operated by Grey County. So that is Lee Manor, Rockwood Terrace, and Grey Gables. So if you do happen to be watching this recording, and you have a loved one in another home, please do contact that home if you have any questions or concerns. And I think that pretty much has it. I will just mention though that we are recording tonight's call and we will make that available following the meeting. So if there's anyone that you know that would be interested in what's on here, you can share that around when we do send the follow-up email. So with that, I will pass it over to you, Jennifer.
Great. Thanks, Rob. So good evening. Thanks very much for joining us tonight. Before we get started, I wanted to just share, I don't know if you can see, I'm wearing this shirt that says love a little. And I wanted to just share that today is World Dwarfism Awareness Day. And I have a 3-year-old niece who is a dwarf. And I'm wearing this shirt to honor and celebrate her and to bring some awareness. And so I wanted to just share some facts that I've learned in the past 3 years. Dwarfism occurs in all races and ethnicities. Dwarfism can be caused by one of more than 200 different types of dwarfism with an estimated 651,000 people worldwide. Words are important as they are for all of us, and particularly in the work that we do with our residents in long-term care. And so with dwarfism as well, when speaking of or about someone with dwarfism, they are not short or midgets. Little people is how they describe themselves. And when they refer to those who do not have dwarfism, they say average height versus normal, because what is normal anyway? Billy Barty is the founder of Little People of America, and he stated, "We are your brothers, your daughters, your friends. We just happen to be wrapped in a smaller package." So in honor of Dwarfism Awareness Month, and today dwarfism awareness is celebrated around the world, I encourage you to take a minute to look up some information about dwarfism, learn some facts, and help speak out against discrimination. So thank you for your time in talking about that tonight. We last met virtually on July 5th, and I just can't believe how fast time flies. At that time, we had noted that we were moving into the new normal of post-pandemic life. And there were a number of de-escalation strategies that happened in July that were really signaling that change. And today, we're balancing that new normal, that quality of life in long-term care with our plans to manage respiratory outbreaks. In this update, I'll do a quick review about universal masking updates, vaccination, N95 mask fit testing for DCPs, talk about some physician retirements, some changes with our phone system, and a little Rockwood Terrace redevelopment update. So getting right into it, in September, we shared a communication related to masking. At that time, the IPAC leads, so infection prevention and control leads in each home, pulled together a group of people made up of residents, designated care partners, and staff. They worked through the ethical framework to look at all the options around universal masking or not. And the recommendation that came from those discussions was to continue to be mask friendly, encourage the use of masking, but not to mandate it. And we had committed to continue to evaluate the use of universal masking as a tool should further evidence or additional situations arise. The Ministry of Long-Term Care recently hosted a webinar on seasonal respiratory illness preparedness and IPAC updates for long-term care homes, which reaffirmed that masking is required for staff based on a point of care risk assessment. So every time staff are having an interaction with residents, they are to do a point of care risk assessment. They also added a recommendation that caregivers and visitors mask, especially in communal areas. Earlier this week, the IPAC leads in each home worked with that group of residents, family members, and staff to consider this updated information from the ministry and to again work through the ethical framework in order to give us an updated recommendation. They also met with resident council. And so, effective today, we will be adding additional IPAC measures during suspect and confirmed respiratory outbreaks in our homes. So the residents described it, and we described it as dialing it up a little. So when any home area is placed in suspect or confirmed respiratory outbreak, the entire home will move to universal masking. For example, if one home area is in suspect or confirmed outbreak, all team members, visitors, and caregivers will be required to wear surgical masks for all home areas. Depending on the agent identified in the outbreak, so is it influenza, is it COVID, is it RSV, is it something else? I've just exhausted my clinical expertise there, but thankfully we have Dana if there's questions about that. So depending on the agent, we'll follow the recommended masking guidelines from the management team and from our partners in public health. So for example, if the home area is in COVID outbreak, that area would follow the masking requirements of N95. Just want to remind everyone that along with masking, we continue to offer a number of IPAC measures to balance resident, family, and team member safety, along with a primary driver of resident quality of life. So we continue to have passive screening for all team members, caregivers, and visitors. We continue to that's encouraging all of us to self-monitor for symptoms and not attend the home if we're not feeling well. Rapid antigen testing sites remain available at each home, and team members have access to kits to take home. And as a visitor or designated care partner, you're welcome to use a rapid test at the site at the home if you wish. They will continue to be available as long as we have testing kits available. We do daily symptom monitoring of residents to identify potential infections early and to prevent spread. We have influenza and COVID vaccination clinics, and I'll talk about that a little bit later. We continue to do our IPAC audits, including PPE, hand hygiene audits. Those are all completed regularly. We have HEPA filter units throughout the home, and we move them around as needed. We always are promoting hand hygiene and access of hand hygiene throughout the home for everyone who lives, works, and visits. And as I mentioned, continuing to perform personal care risk assessments with every interaction to ensure that we're using appropriate PPE and routine cleaning, enhanced cleaning of high-touch surfaces. This is all captured in a memo that will be shared tomorrow with residents, staff, families, designated care partners. I do want to also add that during the resident council meetings, residents shared that they do not want to see universal masking return as it impacts their day-to-day experience in the home. But they feel that this is a fair action to implement during an outbreak situation where spread can happen quickly. They also understand that we may have to escalate these IPAC measures as we head in, as the respiratory season continues, and appreciate that as the season winds down, we may be able to lessen some of the IPAC measures. And I would just like to make a sincere thank you for the teams in the homes having these really important discussions with the residents, staff, and designated care partners. I really believe strongly that this is a co-design approach to some of these decisions that we have to make. And during the the days of the pandemic, we were very much in a command and control situation. There were so many unknowns. And we know a lot more now, and we have the opportunity to involve the people who live at the home in making these decisions. Not everyone will agree with this strategy, but I feel confident that it's a balanced approach to the residents' experience and their recommendation with the evidence that we have around our ability to contain the spread of infections. And if there's questions, happy to discuss that further at the end of the update. Moving on to vaccination plans, we continue to encourage and provide vaccinations for both influenza and COVID-19. And here's a little rundown of what's happening at each of the homes. At Grey Gables, the resident vaccine clinic for influenza was held on October 17th. Staff clinics for influenza are running weekly starting October 19th until November 20th. At Lee Manor, all resident flu vaccines are done, and clinic dates are being determined for staff in the upcoming weeks, so stay tuned for that. At Rockwood Terrace, resident influenza immunization has been happening this week, and for staff, it will be next week. With COVID vaccination, it's a little bit more complicated because it really depends on the timing of either recently having COVID or the timing of your last COVID vaccination. So it's hard to kind of pin down that the vaccinations are happening this date, or this date. It's really based on the timing of the residents in the home and the timing for staff and the timing for DCPs. We can talk a little bit more about that if you like, or feel free to reach out and connect with us if you want to talk that through. Regarding vaccinations for DCPs, there are lots of options within the community. So many pharmacies are offering it, family doctor offices, clinics. However, we will support COVID vaccination at the homes if you need it. So connect with the RN or the director of care, and we will support that. N95 mask fit testing for designated care partners. The updated IPAC standard requires long-term care homes to provide PPE to essential caregivers. We call you DCPs, and to ensure that individuals have access to fit testing where it's required. This is required for N95 masks to fit properly. The teams in the homes are sorting out the logistics of how to coordinate this. So if you're a DCP, stay tuned for details on where and when to come in for your mask fit testing. And if those just sound like weird words like mask fit testing, what even is that? It's literally it's a machine called a port account machine, and it attaches to different to various N95 masks that are available. And you put the mask on, and I can't recall how long it takes, but it's definitely less than 15 minutes. And the person doing the testing runs you through these various scenarios. So they make sure that it's fitting properly. You talk, you stand up, you bend over, you shake your head, and it's really just making sure that there's a good seal on that N95 mask and that the fit is correct for your face. And so that's what mask fit testing is. Physician retirement. We have two medical directors who are retiring, Dr. Power at Grey Gables and Dr. Van Ziel at Lee Manor. And I want to take a moment to recognize and thank them for their commitment, expertise, and contributions to the care at our homes. Dr. Power has been providing care for our residents since the 1980s, and then as medical director in 2008. Dr. Van Ziel has been caring for the residents at Lee Manor and in the role of medical director for just over 10 years. Both of these men have supported our homes through many changes, including changes in legislation, the ever-changing care needs of our residents, as well as a global pandemic. I wish to thank them and wish them all the best in their next chapter. And just give you an update in terms of the transition. So there's a new medical director ready to support the residents at Grey Gables. So stay tuned for a formal announcement with those details. And we are continuing to recruit for the role of medical director at Lee Manor. We're working with our local physicians and the Grey Bruce Ontario Health Team. We're also working to begin recruitment for the role of nurse practitioner. The Ministry of Long-Term Care has announced funding to support this position in long-term care. And if we're successful in our recruitment, we're confident that it will well support the clinical needs of our residents and support the recruitment efforts for physician coverage and the medical director role. Phone system changes. Our phone system is changing. There's some technical words that go with this, but we're migrating to a team system. So the county is implementing a new phone system to streamline processes and improve reliability. I can reassure you that the main numbers for the home will stay the same. And just note that some of the menu options may seem a little bit different on the new system, but are designed to streamline and make it easier to get to the people that you want to talk to. There is some potential downtime during the transition. Typically, it's a period of about 10 minutes while the numbers transfer between carriers, where callers may receive a message that the number is not in service. This could be 10 minutes and it could be an hour. The expectation is 10 minutes. IT staff are going to be on site during the time of the transition and provide us some support. But just wanted to give you a heads up that that could happen. The transitions are happening staggered. So at Rockwood Terrace, November 27th, at Lee Manor, November 29th, and at Grey Gables, December 4th. Finally, an update on the redevelopment project at Rockwood Terrace. So if you visited Rockwood lately, you may see some work happening on the site of the new home, which is just behind the existing Rockwood Terrace. Early site works have started, which is putting in the services and the roads, moving a lot of earth around. We've completed the pre-qualification process for contractors and submitted our plan for this stage of Ministry of Long-Term Care approval. Once we have approval from the ministry, we'll be issuing the RFP, the request for proposal, for the contractor, if all goes well, by the end of the month. So lots of exciting things happening with the Rockwood Terrace redevelopment. And that brings me to the conclusion of the update. Happy to look at any questions that people might have.
All right. Thank you very much, Jennifer. And if anyone does have any questions at this time, please do enter them into the chat feature there. I haven't seen anything come through yet, but you can get those entered in now. And thanks, Jennifer. There was a lot of information in there, I realize, for everyone to digest right now. And I just have to say, it's very exciting to see movement on the Rockwood grounds at the new site now. I know that's been a very long time coming, that project, and that's really exciting to see.
It is exciting, and we're looking at some ways of providing kind of maybe not real-time updates, but doing some, what's it called, Rob, where we're taking footage and then time-lapse type footage.
Yeah, we'd like to get some video and photography from the site for sure. And if we can make something available that it's publicly viewable live, I think that would be something really fun to do. But I think if we're not able to do that, we can definitely set up a time-lapse camera there to capture the progress on site. And I do see our first question has come through here. So what are the official requirements for COVID vaccinations for DCPs now?
Good question. And as at our last meeting, we talked about kind of de-escalating or turning down the dial on some of those things that were mandated. But I am going to turn it over to Denna because there's lots of information, and I don't want to get it wrong. And I am confident that Denna will get it right.
Well, in terms of being a DCP, you are not required to have a COVID vaccination. And in all fairness, where we were doing a primary series of vaccine and then we had a booster dose, the current vaccine that is out there is a brand new for the subvariant. So there are no COVID requirements for a DCP, but in anything we strongly encourage, especially working with and coming to visit folks that are immunocompromised. Vaccines are an important part of protection. So it's not required. It's definitely recommended. So if you have any questions about the new vaccine, don't hesitate to reach out. We can give you some information on it.
That's perfect. Thanks, Dana. I'm not seeing anything else here yet.
So I think that we won't hold people on the line, that we do receive emails when we send out our updates and send out the invitation for the calls. People are replying with questions, and so I encourage you to do that. Oh, I see a couple popped up.
Okay, so Karen is asking, is there a place the Rockwood residents can view the construction progress?
So that's a really good question that I think we'll make sure we take that into consideration. I think that I'm not sure there's windows that will give great viewing access, but we will look at some technology that we might be able to have a space in the home where people can go and see what's going on.
Okay, yeah, I think there's the beautiful gardens out back, and I think the trees would probably make that view not possible from right at the home. But if that is certainly something we can look into. Another question here. If there is a COVID outbreak and we need to wear the PPE for visits, do we have to wear the N95 and have gone through the mask fit testing first?
I'll let you take that, Dana.
So the new requirements for our designated care partners to have mask fit testing have just come out, and so it will take some time. We certainly hope that we'll have time, and we don't want to see a COVID outbreak, but if one does happen in the interim, what we're going to do is do our very best to get you the best fit of N95, keeping in mind that N95 stands for filtering out 90% of the particles, right? So ideally, we want a tight fit for your protection, as well as the protection of others. So if we haven't got there yet to get your official fit test, we will definitely, so that you won't miss seeing your loved one, if you're a designated care partner, we will do our very best to get the best fit in that interim, and we will provide you with an N95. I hope that answers your question, Colleen. Okay.
Yes, Colleen says thank you. Okay, well, not seeing more coming in right now, as Jen mentioned. Certainly, we can take your questions at any time. When you do receive emails from us, whether it's the follow-up to this meeting or one of our monthly newsletters that come out, you can always reply back to those emails, and they will come to myself and my team, and we'll make sure that they do get filtered to Jen or someone in the home, depending on what the question is. So never hesitate to reply to those if you do have any questions. And Dana or Jen, did you have anything else that you'd like to end the call with tonight?
I would just yeah, it's 20. I think it's still 20 degrees out there, so if people want to head out there, because I think we're in for some cold. But no, again, just echoing what you said. If there are any questions, particularly anything related to infection prevention and control, or some of the decisions, don't hesitate to reach out to each home has an IPAC lead, as well as obviously the RNs on the floor, your DOCs, your leadership team. Don't hesitate.
And I'll just wrap up, and I'll answer Colleen's question as part of my wrap up. So Colleen's question is, if there's no doctor in place, what happens for annual care conferences? And that's a good question that's weighing on our mind. And so we're working with the partners that we have to support us to make sure that we have physician coverage. So stay tuned, where this is actively happening right now as we speak. So we will have a plan in place to make sure that our residents have the medical care and support that they need. So we'll keep you posted. And then just to wrap up, thanks again for being here and being part of the care team at our homes. And don't forget to love a little or love a lot. It's a great slogan. And yeah, thanks for your time. Have a great night.
Good night, everyone.
Right.